Welcome to the Dr. Masi and Dyl Show. I'm your host, Dylan Loquist, and I'm joined here with
Dr. Masi Reynolds, orthopedic sports medicine specialist.
And in this episode, we're talking about
Matt Meola.
Dr. Masi, who is Matt Meola?
Matt is so multidimensional. He's a free surfer. Some have been called him the aerial Jedi of his sport. So he's a pioneer in the aerial world of surfing. He actually was the first one to do this thing called the spindle flip 540, which is a crazy upside down rotational type of a spin that he's doing out there. He's won multiple surf awards, including an intersection winner in 2011. He won a surf award for the best maneuver for that cork backflip in 2019 and multiple stab awards in 2021. He's also collaborated with surfboard designers and is an innovator in the actual surfboard world, creating amazing boards for the aerial game. On top of that, he's an environmentalist. He loves to fish and he loves to hunt and he loves to do it in a way that helps regenerative practices and through sustainable hunting and fishing. And on top of all that, he's an incredible musician. He's often seen collaborating with his sister, Lily Meola, with his guitar skills.
Matt certainly is multidimensional, and we had an awesome conversation with him to prepare for this episode, and I just loved just talking to him and getting to know the human behind the injury. He's a sick dude.
Yeah, and I hope that everyone else through our conversation can actually see the Matt that we know and see. And like you said, just being able to really recognize who he is behind his injury.
We talked about the injury itself, how you diagnosed it. We talk about the anatomy involved in the injury and even go over the MRI. Yeah. And it was really cool to see where the conversation took us. I think a lot of people take away some good things from this.
Yeah, and even just seeing his mindset and how he approached the injury is really cool. It's so unique. And I think that a lot of people can learn a lot from Matt.
Without further ado, please enjoy this episode of Scar Stories.
Let's go. Roll the intro. And we're here, and then we're talking about blah, 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 blah. And then it's like,
and then it's kind of like just the lead in.
Lead in. And then it's like,
we could start right now and just be like, well, how did you meet Matt?
Yeah. Well, that's exactly right.
Okay. Start now.
Yeah.
All right. Yeah. Well, how did you meet Matt?
Actually, originally I met Matt when he was, I want to say like 16 or 17, 18 years old, something around there. He's a teenager. I don't remember. But, I have family that live on Maui and spent a lot of time there in my pre-med days, medical school days, and even residency. And my in-laws were friends with Matt's mom, Nancy Meola, who's epic. And we were out at the Maui Film Festival, and it was, I want to say it was, 2007, 2008, maybe somewhere in there. Is that he was getting the award for intersection, or the intersection award for his part. And so I got to see, 2011. 2011. Okay, 2011.
That's when he did the spindle flip 540.
It was the first time they saw. I mean, it was an epic part. It was the first time I really got to see like how talented he truly was. We were out just enjoying a night at the film festival, and he got the award, and just to see him celebrating with all of his crew, all the boys, his family and everything, he was like over the moon. Like he was so stoked. And I think, he even said it on the call when we were talking to him, right? Like that was when he had a gut check and he's like, I guess I'm a professional surfer now. Yeah. Like, it's like, I got to figure this out. And so, yeah. And so that was kind of my first introduction to Matt. I knew him through his mom, Nancy, who's amazing, and unfortunately since passed, but she was super incredible and friends of the family, and got to know a little bit about Matt, but Lily, his sister as well, through Nancy. They lived in the same neighborhood as my in-laws. And so, super peripheral, like, we'd have conversations. His mom would send me MRIs of his back, just kind of for second opinions and things like that. And so kind of just followed his journey and it would run into him every once in a while, but didn't really kind of know him at the level that I do now, after his most recent, shoulder injury. And that's when I really got a chance to kind of unpack the onion that is Matt and the layers that exist with him. And so, I knew him for a long time before he reached out to me about his shoulder.
He's had other injuries before that, right?
Well, there's a reason why they call him the aerial Jedi, right? Like he's been such a pioneer in the air game and surfing. Like, so originally he was obviously Maui surfer and then got into the big wave scene. I think when most people actually started hearing about him, he was out sitting on the inside bowl with Albie Lair at Jaws, where no one else is kind of sitting back. And he even said on the call too, that it just wasn't for him. And that's exactly right. Like from a physical stature and from a framework standpoint, like he's not the biggest guy, he doesn't have a ton of muscle around him. And I think the big waves definitely take a toll on him, but that is an advantage in the air game, right? Because he's light and nimble, he's flexible, he's mobile. Yeah, exactly. And so he's always been super talented as far as air game. And then on Maui too, with the wind, he was able to use that, to his advantage in order to progress the aerial aspect of surfing. But unfortunately, with that comes high impact and torsional type forces and things like that. And so, not that he's fragile by any standard, but definitely has, gone through his ups and downs physically with his body because of the air game. So small things here and there for the most part.
So what do you normally see from someone doing all those airs? Is a lot of impact injuries? Are they blowing out knees?
It's more and more common now, right? Obviously, every Grom out there is doing airs. And so we're seeing a lot more ankle injuries, a lot more knee torsional. So a lot of it is when one foot stays on the board and the other one kind of slips off, the board will kind of take off with your foot stuck in the wax. And so depending on the rotation of the board, whether it's internal or external, or whether it kind of shoots out just laterally, they can get their MCL. I've had ACL injuries. Unfortunately, we had which we'll probably talk at some point, a young surfer from San Clemente with a really bad hamstring injury. We've had plenty of ankle injuries. And so it's a combination of that as well as impact. So a lot of times we see impact coming down on a board with an ankle kind of twisting on it, or, kind of pressure through the hip joints, lower back, that kind of stuff. And so we're seeing a lot more just lower extremity injuries in surfers that we haven't seen prior to the kind of the evolution of the aerial game in surfing.
All those injuries you're mentioning, it's funny because Matt didn't hurt his knee or a previous injury with the knee, because I remember on the phone call he's talking about what he learned from that previous injury. But that's, I guess, what we're talking about right now is his shoulder injury, right? How did that happen again?
Yeah, the most recent thing actually wasn't even surfing. It was he was on an e-bike. Yeah. And that's also another. That's another comment. Yeah. Oh my gosh. As the aerial game and the e-bike game is. I like to say it's good for business, but I mean it's like it's keeping me too busy. Like I don't. It's so. Yeah, he somehow flew off his e-bike and kind of landed on his shoulder. I think he was talking with Sam, Campbell, Mackenzie Brown on Maui after he, smart guy. He's been injured before, and so he knows kind of how to manage it. I think initially didn't really seek any sort of a formal medical advice. Just was like, I got a bum shoulder. I can't surf. I'm going to see the team that's, rehab the best in the world. So we started kind of working with them, and just, really wasn't progressing. Didn't see much in the way of improvements with strength and range of motion. Wasn't able to surf. And so, that's when they reached out to me.
When you have an injury that isn't responding to rehab, or should I say prehab, right? Because you're trying to, your first inclination isn't to go under with a knife.
Yeah.
You want to see, I mean, when he, like, what symptoms was he telling you about? Because, what was the story when he gave you that call? Were you thinking, I want to go in there and look on a scope?
No, never. No. You know what? I think most athletes, for the most part, especially the ones that have had injury, understand a couple things. Like, is this bad enough to require something like that? They get a sense of like, okay, this is really bad. I'm injured. It's kind of the whole like saying like, are you hurt? Or are you injured sort of situation, right? And anyone who's kind of had experience understands that like a lot of things that we sustain from injury standpoint will heal itself, and it's our job just to support it, right? Whether it's through PT strengthening, balance, or giving it a little bit of time, or the combination of both. Obviously, there's a lot of things that we're doing now to optimize, but for the most part, let the dust settle. They see how things progress and then kind of make decisions from there. And so, fortunately, I typically get called after patients have MRIs or have been fighting things for a while. I do sometimes get called acutely, like right after an injury, but for the most part, it's after, athletes have, attempted to rehab things back. Yeah, and fix it. And so, for him, it just wasn't progressing. And so they, called me after he had got an MRI. And a lot of times it's just translating what the radiologist is saying. And sometimes it's getting on the phone and nuancing and picking apart the MRI. And unfortunately, sometimes it is talking about operative interventions or even, less invasive type treatments on it as well. So they gave me a call and I was like, hey, Masi, will you look at the imaging, talk with Matt, on it. And I was like, yeah, happy to, man. Like, unfortunately, I think I was in Fiji at the time. I was in Tavarua. And so I was on a boat in Cloudbreak trying to get on the phone with him with like no service and hearing like every other word, trying to pick up his story. All I heard is e-bike fall, pain, MRI out. Yeah. And I was just like, okay, send me the MRI. Let's look at it and kind of go from there.
Yeah. So he sent you that MRI. Could we look at it?
Yeah. Absolutely. So, the tricky part a lot, and this isn't to kind of throw shade at radiologists or anything else like that, but they really don't have much in the way of clinical context, right? So they're just looking at an MRI and really just trying to find pathology. And most of the part, they do a good job of just being overly, they kind of hedge in some ways. They say possible this, possible that, kind of et cetera, et cetera. But his MRI read and report was pretty negative, actually. And so they didn't have much to say on it. And so the luxury that I have is to be able to communicate with amazing physical therapists and athletic trainers and even the patients themselves so that I can, in my mind, put together the full story, the mechanism of the injury. And then it allows me to hone in on specific areas so that it can be a lot more kind of nuanced in that area on the MRI than any sort of radiology. Not to say that they won't, but just I have just so much more clinical context and data to be able to kind of hone in on.
Well, each piece tells you a little bit different of a story. And MRIs are a great way to, I know you've called it like, it's the bread and butter. Like you need to see it. It's a very good diagnostic tool, but sometimes it's important to listen to what the patient is experiencing. Like with Annie, telling you how she's feeling. You pair that up with the MRI and it gives you just more data, like you said.
Yeah, it's powerful. It's just that it's not everything, but it's super important. It's just, it's a data point that we use in combination with multiple other data points in order to get to the nuances and the specifics and the details of the injury so that we can kind of put together the best plan moving forward. And so, it's a huge part of it. And his MRI was unique in the sense that I think it was just read as negative, meaning on a kind of a normal shoulder. And so it wasn't until I had that conversation with him and Sam and the team, and then looking at the MRI, that I could really kind of pick apart. Because, what he had and what he's been dealing with is something pretty, I'd say, rare in the sense of that, like, it's not typically seen on an MRI, and it's less commonly injured. It's a part of the shoulder that's not as injured, and kind of is, it's an afterthought and a little bit ignored, and because really it's mainly only problematic in patients who need to use their shoulders the way that Matt needs to use his. So
what are we looking at here?
This is what we call the coronal view. So this is the MRI T2 coronal. T2 is typically the reformat that we like to go to when we're looking at pathology, because what it'll do is it'll highlight fluid or inflammation, which ultimately, when we see that in areas that we shouldn't, it can identify tears, it can identify bruising, bleeding, just swelling in certain areas. And so this is the humeral head. So if we go here, this is the ball portion of it. So the humeral head portion of the joint. This is the socket. Again, the golf ball, golf tee analogy. This is the top of the joint that we call the acromion, and the clavicle coming this way. Matt's head would be in that direction. His left shoulder would be over here in this direction. Okay. So can you see that there? Yeah. Okay. So as we scroll back and forth, what we want to look for is white, meaning fluid where we shouldn't. As I go to the very, very front of the shoulder here, you can see there's a pocket of fluid, an area of white into this area. This muscle belly right here is what we call the subscapularis. That's the front portion of the rotator cuff as it kind of sits right here. And then the supraspinatus kind of comes over the top here. This is what we call the coracoid. And this little window right here is what we call the interval, right? The rotator cuff interval, meaning it's between the supraspinatus and the subscapularis. It's where the biceps tendon kind of runs in. And it's an area of soft tissue that doesn't provide a whole lot of structure, but it helps with the biceps tendon as it comes into the shoulder. And you can see that there's white fluid in the area. And so it looks like there's some swelling and fluid and potential tearing of that interval portion of the shoulder. And if we go to this view, you can also see it quite well into the front of the shoulder. It's all that white that you're seeing behind that coracoid. And especially as we kind of come to the top there, you see that there is a lesion, if you will, or an injury to the interval tissue kind of between the subscap. And
so how does this come up as negative? I mean, as in you could find it, or is it more so the specific region of this rotator cuff interval?
Well, yeah, just because, I mean, if you're looking at the rotator cuff, so this is the rotator cuff coming over the top, and that's fine, right? There's no, from a structural standpoint, that's not torn. And then typically we look at the subscapularis in this view, and for the most part, there is some fluid in it, but that tendon looks okay too. And so those are the main kind of the common structures that are injured. And so it's not really, I would say it's not necessarily not important, but it's not really focused on, right? As a structural component of the shoulder, that is worth kind of mentioning as in the report. But what ends up happening is that interval gets disrupted, torn, strained. The biceps actually runs up into the shoulder joint through that interval. And so what happens is that biceps can kind of sag a little bit. It can cause a little bit of instability. So that biceps tendon can kind of move around in that shoulder a little bit and kind of catch. And for the most part, patients get this almost like what we call pain inhibition. Like they go to lift it, it causes some discomfort and pain, some catching, and then they have difficulty abducting or lifting their shoulder, with kind of subsequent weakness in that shoulder as well. And so it's kind of a unique injury. Again, more on the rare side, but we do see it in our younger athletes.
So it's the biceps tendon that's like probably the main thing that was torn.
Well, it's the sheath, if you will, or the soft tissue that the biceps lives in, if that makes sense. I know it's kind of silly and we nuance it that way, but
we could pull up the anatomy to try to make more sense of it. I'm seeing all these muscles on a 2D black and white image.
For sure.
It can be a little bit difficult, but luckily, I'll pull up maybe a little bit of Z anatomy.
Let's look at the anatomy. Yeah.
Cool. So we have Z anatomy pulled up here. Well, I guess let's look at the rotator cuff interval, what we were just looking at on the MRI, right?
Yeah.
To orient everyone, right? The subscapularis, which hugs the, let's do this. Is that better?
Yeah.
Cool. So we have the subscapularis. This is the rotary cup, right?
the rotator cuff.
The rotator cuff. Yeah. The
one of four. Yeah.
Supraspinatus, infraspinatus, and teres minor. I don't know. Do you have anything else to talk about for the rotator cuff now that we're actually looking at it?
No, I mean, obviously super important for overhead athletes, super important for all of us, right? In general. Yeah. Nothing more to say on that.
Cool. Then let's dive into this specific area. That we were talking about, right?
Yeah.
This is the interval.
Yeah. So you see that biceps tendon as it runs up into the shoulder right there. Yeah. That comes up and enters at the top of the socket here. And what you can't see, I mean, you do see kind of that interval and we'll kind of mark that out here. That's the area between the supraspinatus and the subscapularis, but that's a soft tissue, almost like a sling that holds that biceps in place. And so that's the area that Matt injured is that interval of connective tissue between those two muscle bellies that you did a good job of highlighting right there.
Oh, so. Yeah, the subscap. Okay. So this is what it looks like on an anatomical level. Maybe it wasn't healing because it doesn't look like there's a lot of blood vessels going to this area.
Yeah, for sure. Thanks for mentioning that because you're right. It is in that whole zone. Like, I mean, way out here on the rotator cuff as it inserts onto the bone, the blood supply is just terrible to begin with. You know, we call that the watershed zone or the critical zone because, you know, it's an area of depleted blood supply. And so most of the time injuries in there, even if they do heal, they can take a long time to bounce back. And especially since there's really no muscle belly in the actual interval itself, it's all connective tissue, soft tissue. There's very little blood supply over there. So.
Yeah. Why is that? Is that just because if you use something more, blood vessels will propagate to that area or what?
Yeah. You know, especially in muscle, like there's a lot of blood in muscle. We need oxygen to get to the muscles in order for the actin, the myosin, ATP and all that to work. Whereas we don't necessarily need that in the connective tissue as much, right? We want it to be able to heal, but at the same time, we don't utilize the vessels as much in that area.
Well, we need that to be freed up so that we have range of motion there.
Yeah, right? Absolutely. Yeah, for sure. It's
there's a reason.
Yeah, absolutely.
What were the next steps after this? Did you what were you thinking for treatment? Because it sounds like you didn't want to cut first, but now are you thinking about going under with a knife? Like what would you fix?
No, I mean, it's tricky because Matt was super patient and meaning like he wasn't really pushing. It was hard to get a gauge because I hadn't seen him yet. I only got on his imaging and I've only talked to Sam. And so I didn't really get a good sense of like how urgent this was. I usually lean on my athletes to kind of guide that with regards to how aggressive. And he seemed kind of, I guess, laissez-faire about it. Like, yeah, whatever. But, and if I don't get better, I'd like to do something. I said, yeah, just let me know. But my initial thought for something like that isn't necessarily to go in and fix anything. It never really is. It's whatever we can do from a conservative standpoint to utilize the power of the human body to treat itself. And so for me, if we're going to do anything, it's going to be biologic intervention, whether it be stem cells, via bone marrow aspirate concentrate, adipose-derived peptides, or even platelet-rich plasma or PRP. I think Matt wanted to go slow. he wanted to go as conservative as possible. And it was, I want to say spring time. I think he was doing a lot of snowboarding trips and missions and stuff like that. And so I think he was trying to just work around a window after one of his trips to kind of swing by our spot to kind of get it checked out. And so that's what he ended up doing. I think he was on his way back from a snowboarding trip and then get an epic bald face trip, and then was able to kind of swing by where I could actually examine him, spend some time, ultrasound, and then what we ended up doing was a PRP injection. I did a combination of it. I did a leukocyte-rich is what we call it, so a lot of white blood cells. We did a leukocyte-rich preparation, 60 cc blood draw over 11 billion platelets into his interval, into the front. So exactly what we're talking about over here. And then I did a leukocyte pore preparation, so less white blood cells into what we call the subacromial space, so above the rotator cuff and below kind of the bone on top, which is called the acromion up there. Yeah.
Right.
So
here's the acromion. Oh no, this
that's
is the acromion right here. Right?
Yeah, exactly. So right in that spot up there. Yeah, right above it. Because there's a little
right above it. Okay.
Right below it, but right above the
right here.
Yeah.
Almost like in between the muscle belly and the bone.
Yeah, exactly. Oh. So there's a little bursa that sits there. Do you know what a bursa is? Bursa.
I do, but
not to test you.
A bursa is typically it separates, right? It's a little bit of cushion.
Yeah.
What is it filled with again? Though?
Like it's fluid. Yeah, it literally is. It's like I like to think about like a little kind of flat fluid filled ball bearing, right? It's areas. It's located in areas of high friction, right? High motion between two tissue planes, and so our rotator cuff is moving, pretty. A lot. Yeah. Underneath our acromion, same thing around our knees and our elbows. There's these little bursts that kind of help provide a friction-free motion.
Like a Baker's cyst, like is a bursting of a bursta.
Baker's cysts, no.
Okay. I don't know.
Yeah. We can go to Baker's cysts, but that's fluid that pushes out of the knee because of disruption in the capsule. But it's just you can get like this swelling on the elbow, which would be like a leckeron bursitis, or sometimes you get infected and we call that sometimes we call that like a septic bursitis or things like that. But you can get a traumatic bursitis, and I think he had a combination of the interval lesion, which I think was his number one, just based on my exam and symptoms, but also he came down on it pretty hard and he banged the head kind of into the acromion, and so that developed a little bit of a inflammation of the burst on top. So I just decided while we were there to do a little bit in the top of the shoulder as well. And Matt's approach is kind of which is mine too as well. If I have a lot of time to work with an athlete, is I like to call it the minimum viable product. I know they say it a lot in the startup world, right? The MVP, which is the least amount to gain the most results. Yeah, exactly. And so we started with the PRP. I want to say he started some peptides kind of shortly afterwards. We talked about doing stem cells at some point, but really wanted to just see how he responded to the PRP first, and then kind of go from there.
So the point of doing the PRP is now you're injecting a rich amount of blood that otherwise isn't there, right?
Yeah. So what we do is the procedure is pretty simple, relatively speaking, is we take a good amount of blood from a typical venipuncture, so 60 plus cc's of blood. That is combined with a anticoagulant, and an activator. And then we have a double centrifuge system that we use to extract the cells that we want for reinjection, right? And that's mainly platelets, sometimes white blood cells as well. And that's why we call it platelet-rich plasma, because we're injecting some plasma in there, which, is hydrating, right? There's some amino acids in there. There's some fibrinogen, but for the most part, it's platelets. And then platelets, what they do through their alpha granules inside the platelets is they release growth factors. And these growth factors, I like to think about them as like these signals inside of our body that then recruit blood vessels to come into the area. They recruit more fibroblasts to build up tissue. They will recruit cells that are responsible for bringing in new nerve endings, kind of, et cetera. They're kind of like the general contractors, if you will.
Sounds like I was thinking a bat signal.
Yeah,
it's like Batman comes
the SOS,
us,
man.
And it brings in all the. It's like sounding the alarm.
That's exactly
to wake the body up to do its natural thing that it does and heal itself. And that's what I guess. Putting Matt's whole story together, he was trying to do some non-surgical options and just rehab and wake the body up to responding to that area.
Well, the response is always there, right? Every time we have an injury, our body is smart, right? It's always sending out that SOS all the time. But unfortunately, depending on the location, like we talked about the blood supply, or unfortunately also there's physiological factors, whether it be age or inflammation, chronic disease, et cetera, that signal can be significantly dampened, right? And we do know that the response is also dampened based on the limited amount of resources that we have in the form of circulating stem cell reserves, right? And so what we're ultimately doing is just amplifying that normal bat signal, if you will, that SOS, right? We're doing it just at much higher magnitudes. We're louder with that signal, right?
And so louder it got, and louder. Like what happened next? I guess how quick was the recovery? Was he back to sport? How soon?
Oh man, no. Like, so Matt, like,
how did he stay busy until then?
So his was a little bit slower in a response, meaning we didn't really see anything. Like I think maybe 3 or 4 weeks after the PRP, he'd reached out to me and talked about, hey, let's talk about next steps. Let's start stem cell, kind of, et cetera. It just wasn't quite there. It wasn't worse, but wasn't, tangibly, it, just didn't seem like it didn't significantly improve. And so we were talking about getting him on the schedule to come in and do a formal full-on stem cell type of a procedure. And then I want to say, like, literally overnight or a couple of days later, he really started seeing significant improvements, and he kind of turned the corner on it as well. And so, yeah, he was, it was a little bit tricky from my perspective, working with Matt, because for the most part, I'm used to really getting pushed to try to get my athletes back sooner. We always talk about therapeutic windows, meaning I always try to intervene, if we're going to intervene with an athlete, in the best possible time, realizing that there's never really a great time, right? But if we can find a good little window, then I don't feel the pressure to have to get a patient back sooner than or an athlete back sooner than I want to, and give them, that therapeutic respect that they need in order to kind of let the body do its thing.
Their livelihood is on a way.
Exactly.
They got to get back out.
That's exactly right. So I'm known to definitely want to push to the barrier as hard and as close as I can get to it, but at the same time, knowing that we have to respect biology and respect the body. And Matt was different. Like I felt more of an urgency than he felt.
You're becoming impatient.
Yeah, I was becoming impatient. I was just like, Matt, let's do something. Let's do something. Let's do something. Like, I felt the need to want to do more than actually Matt wanted to. And that was kind of a newer thing for me. Yeah. Because he was super patient, and I said laissez-faire, but just, it wasn't that he didn't care. It's just that it was like, I'm just going to be patient and just watch, wait and see, and allow my body to do its thing. And so just kind of taking his lead on it was new for me when it came to how patient he was dealing with it. And I mean, you heard it on the call too, like with him, and we know why, right? Like,
well, he's able to stay busy in other ways.
He stays busy.
That was cool to hear, because he, like, a lot of, I think if there's anything to learn from this story, it's, well, to have patience, in your body's natural healing process, but also to have other ways to express yourself, or not. Like, I mean, Matt is an aerial Jedi and a free surfer, but he's also a hunter and a fisherman, and just plays a huge role in the community there on the island of Maui. And he was able to stay busy in other ways that he wasn't rushing to get out there to heal. He was able to, I don't know, the multidimensionality of Matt was big.
Yeah.
And, do you see other patients that have that ability, or how does someone learn that? Or is it just finding other ways to make you fulfilled outside of your thing?
Yeah. No, it was really cool to hear Matt actually articulate that. You can see it, and obviously I saw it through him in managing him, but to actually hear him kind of talk about it was really cool, and his passion for other things outside of surfing, and the way that he described it as well was kind of spot on with regards to what I was thinking was going through his mind. That he was just like, I'll fish, I'll hunt, and I'll just give my body this time. And I think part of that is the maturity that he developed through injuries that he's had before, and I know that he felt like maybe he rushed through a knee injury quicker than he wanted to before. So he had a little bit of that as well. And to answer your question, I don't know how it's learned or taught. I would say, the majority of my athletes and patients do have things that kind of keep them going outside of their kind of main discipline, if you will, their sport. But I would say I'd want them to, you know what I mean? It would definitely help my situation, and I would be able to approach it with a lot less stress. But a lot of times these athletes are who they are because of their commitment to their discipline too, right? And to be able to look at it in the way that they look at it.
Not everyone can be multidimensional.
Yeah. Or want to be.
You know, exactly. Yeah, that's true.
Yeah. Or we want to be. And I think that a lot of people can if they decided they wanted to be. But like I think I think it's a little bit slippery because I think a lot of times athletes are who they are because of their commitment to that single discipline from the early ages up until the professional ranks. But I would kind of recommend that for sure. I mean, I always do work with my athletes and patients to be able to find joy, purpose, love, and fulfillment in things outside of their sport and their discipline, at least during the recovery process. And I'd say the majority of my patients, after especially bigger injuries, but just injury in general, and you hear them say it all the time, but at the other end of it, at the end of the tunnel on the other side, they're like, gosh, like I have such a deeper perspective. I have much better appreciation. And I feel like I'm better off after this injury and recovery journey than I was before. They learn from it as well. And I think part of that is exactly what you're talking about too, is that they find, maybe they didn't know that they could have that multidimensionality, and they end up finding other things that kind of give them that same joy and purpose.
Yeah, they recognize that it's more than just like, I don't know, it's almost like the universe testing them. Saying, can you figure out what this lesson's trying to teach you?
Yeah, that's exactly right. But for our young athletes, it's tough because they've just been so goal oriented and driven for so long, and they've had this North Star, and then all of a sudden they get derailed from the course. So that North Star, it's this kind of, it's a whole shift in identity. And that's, it doesn't have to be, but it definitely is an awakening for sure.
I think if there's one thing to take away from all of this, it's just trust the body's natural process of healing. And sometimes you might need give it a little boost with a PRP, or, it also has some mindfulness and a good support group like yourself and everyone else who Matt had surrounded himself by, and eventually you'll be able to get back out there. You just got to trust I think the process.
I think the timeline is your timeline. I just think the body, you can support it in every way, and obviously we're always constantly pushing to be able to optimize the way in which we can support the human body in its recovery journey. But ultimately, it has an intelligence of its own, and and if you're patient with it and doing all the right stuff, you'll be back. It's just going to be on your timeline. So yeah.
Well, I think that's a good place to end the story. I feel like
I'm stoked. I'm happy for Matt. I mean, he's back out there, obviously doing well. It was awesome. I saw him on Maui. Gosh, I want to say a few months later. I was in August or July. I was out there. You got a chance to see him, get the ultrasound out at Deep to Peak, and kind of look at his shoulder and examine him. And he looks good as new. He looks great. I'm stoked for him. And obviously he's kind of mental. I don't know if you saw him surfing out at Waco.
Certainly he's been tearing it up. His shoulder is definitely healed.
Just charging, man. Like I love it, man. Like he's still, as one of the pioneers in the aerial game and so many young upcoming surfers out there, he's still at the top of the ranks and just kicking butt. So,
he's out there hunting too, fishing. He's living life, man.
I'm stoked for him, and I'm stoked to tell his scar story and his journey, and I appreciate him allowing us to have this conversation. So,
well, I mean, do you want to thank you, Matt, for letting us tell your story?
I love you, man. Appreciate you, and stoked to see you out there. So.
We'll see you in the next episode of Scar Stories. And I guess we'll we'll end it right there.
Perfect.
And cut.